Hello, my name is Catherine and I am the social worker with the Caring for My COPD program at Grand River Community Health Center. In this video, I'm going to be covering another one of our education sessions, healthcare navigation. So we're going to talk a bit about our healthcare system and kind of how it operates at the best or most regular of times. We'll talk a bit about the ways things have changed right now and how things might have changed in terms of how we move about or how we access care right now. We'll talk a bit about trying to have the best possible communication with the providers involved in our care. And we'll also talk a little bit at the end about advanced care planning. So if you are here for this video, hopefully you have had a chance to look at the handouts or you have them in front of you. I won't be going through the handouts piece by piece, but hopefully this video will just add to them a bit and build on them, and like I said, speak a bit more about the context of where we are right now in terms of receiving care in the midst of COVID-19. So I think when we think about the healthcare system in Ontario, at the best or most normal of times, it can feel like a bit of a complicated system, right? That, you know, all of us have experiences with our healthcare system and the various parts or players of it. So whether that is receiving care from our primary care providers, whether we have had specialists involved in our care, whether we have had experience with hospitalization or emergency departments, and all of those experiences, we hopefully learn things along the way, and hopefully we've had many positive experiences with the healthcare system, things that have gone well, receiving the right care from the right person at the right time, receiving respectful care, care that we felt we were able to actively participate in. But we know that sometimes the way things go, that maybe they don't go as planned or they're not as positive as we might like. We may have had some downright challenging or negative interactions with the healthcare system. But hopefully there are some things that we can maybe learn from those experiences, and maybe we can find ways to hopefully not repeat them, to hopefully go on to have better or more productive or helpful experiences in the future. And so we know that, again, moving around our system can be an interesting thing sometimes. And I think nothing more than that right now in the age of phone and video-based care, which I think is a new experience for many or most of us on both sides of the phone and the camera. And that we're in uncharted waters here, and that we're all learning together as we go. We might get some things decently right from the outset. There may be some things that we're still figuring out together, how to do them better, how to make the experience more collaborative and more rewarding on maybe both sides, and feeling like needs are being met in a way that we want to meet them. Sorry, I was referring to my notes. My eye contact is down. And so we know that there's lots of research that gets done about our healthcare system, and, you know, finding ways to try to improve things and ideally do things better, make it meet the needs of, you know, a population who the demands that are placed on our healthcare system grow and grow and grow. And our healthcare system sometimes gets delivered from that place of, you know, needing to do more and more and more with the same or less resources, which puts a lot of strain on the system. And sometimes that strain comes through in people's experiences and the areas that we might have some challenges or some things that don't go so well. And so we know that research and just our own people's experiences tell us that some of the areas that we can struggle the most in our healthcare system are around navigating, so just moving about the system, knowing what services are available where, knowing how to access services, who to call, who's responsible for what's most appropriate for our primary care provider versus a specialist versus a walk-in or a hospital. Again, just moving about those different settings. We know that despite lots of advances in technology, repetition is still a big struggle in our healthcare system. So whether it's, you know, when we move about from place to place or provider to provider, having to repeat our story, having to repeat our symptoms, repeat our history, maybe even having testing repeated, that can cause frustration, and that can cause delays, and it can cause maybe doubt in how things are going in our healthcare experience or our healthcare journey. We know communication, like I said, we'll talk more about communication, but we know this can be an area that can go really well, or it can be a really big struggle in our healthcare experiences. But sometimes some of the gaps we have are when we might worry or question, or we've had an experience of information, referrals, tests not making it from one provider to another, or from one setting to another, right? We live in an area where, there are some specialists or specialties that we don't have many of in town, or having to travel out of town for. So we might be waiting for a while to see certain specialists, and maybe you've had the experience that when you got there, they didn't have the referral package. They didn't really know why you were there, or you're having, again, to repeat yourself and play a bit of catch up for something you maybe thought you wouldn't have to do, that they would know all that when you walked in. And another area we can struggle in is just transition. Any spot of our system where we transition from one provider to another. So again, primary care to specialist back to primary care, where we transition from one facility to another, one agency to another, and a big transition point is if we've been hospitalized, and that transition from hospital to home. That can look all kinds of ways, and people have all kinds of different experiences of what it's been like to be discharged from a hospital, and we can hear all kinds of stories about things that went well, and we might hear all kinds of stories, and people are often happy to share their stories of things that didn't go so well, services that didn't get arranged, information that didn't get to where it is. And so it's not an all doom and gloom. We know these things about our healthcare system. We know some of its pressure points, parts that it struggles sometimes, that it puts a higher onus on all of us as consumers of healthcare to take an active role as best we can in our healthcare experiences, in our access of the system, in the conversations that we have about our health, to try again. And that taking that active role may come naturally for some, and it may come not so naturally for others, right? It might be more of a struggle. And so that taking an active role in our health requires varying degrees of something called health literacy. And so at its basic level, when we think about health literacy, that just thinks about, for each of us, all of us, that is our ability to get or receive information, to understand that information, communicate that information, and then use that information to make informed decisions about our health. So informed decisions about treatments we may undertake or not. Informed decisions about medications we may choose to take or not, specialists to see, tests to have done. Again, hopefully making those informed choices, meaning that we understand and have an appreciation for both the potential benefits of something, but also the potential risks or potential side effects. And then we can use all of that information to try to weigh things out to make the best possible decision we think we can, or a decision that we feel is in our own best interests for where we are at the time. And again, so when we think about health literacy, it doesn't have to be big fancy things that we do. We kind of build and practice our health literacy skills whenever we know you get prescribed a new medication, or even medications you've been taking a while, and you make sure you know why you're taking that medication, and you know how to use it properly or when to take it. That's health literacy, right? So being informed about our medications, when we follow directions to prepare for a test, procedure, or surgery, when we take medical advice, maybe we fill out forms, and we hopefully start to learn ways and reputable places or people to go to obtain information. So if we're not sure about something, knowing who's a reputable source to talk to, if it's maybe not our direct providers, being able to weigh out quality health information versus some of the other stuff that's out there that might not get us where we want to go. All right. And so when we're moving about the system, like I said, in even the most regular or normal of circumstances, the communication that we have with the people involved in our care is so important. And that communication can look lots of different ways and can bring varying degrees of quality. to the experience we have, right? The communication, the relationship, the rapport we have with the people involved in our care can be a big part of what makes us look back on things and remember things positively. But it can also be the opposite of that can be true as well, and that sometimes the struggles we might have had in relationship or rapport or communication can contribute to feeling like something hasn't gone very well. Whether that's in our kind of day-to-day health care needs, or it's a hospitalization, or it's accessing a community program or service. Communication plays a big role across the board. And especially right now, like I said, I would say it's always important in my opinion. But there's a different layer of importance right now as we, again, access so much of our care, maybe by phone call, or maybe we're doing some sort of video access, but a lot of it's by phone, right? Where we don't have the benefit of facial expressions and body language that may help us sometimes to communicate, as I stand here as a hand talker, but and also just to help us read the situation we're in. And especially, if we're having phone calls with people that we don't know well. Maybe we've got folks involved in our care or health that we really haven't known very long. So we just don't have a lot of offline relationship to pull from on the phone. And so some tips and tricks, things maybe that you're already doing, things maybe you've done in the past, maybe things you haven't considered, but that I think can be helpful all the time, but maybe have a different level of importance right now in this kind of different reality that we're in our healthcare system. And so when we think about what we might do, would encourage you to be honest. Again, so because our providers may not be seeing us in person, so we might need to tell them things that feel obvious to us, but that may not be very obvious right now, right, when we're not seeing them. So being honest about what's going on with us. Because, our providers can do a lot of really wonderful things, but they're not mind readers, even when we're right in front of them, right? So if something's not going well, it can be in our best interest to speak up, but sometimes that can be sensitive things. And we know that some things that can be really difficult to talk about are, concerns about mood, concerns maybe if we're having falls. We might be nervous to bring that up, concerns about driving, and maybe concerns about intimacy. And so all of these things can be sensitive, and that might keep us from mentioning them or bringing them up. But it can also keep us from potentially receiving care or assistance or supports that might be really helpful. So we just encourage you, again, just to give an extra layer of attention to just being honest with our providers right now, especially, like I said, in this kind of situation we're in how care is being provided in a different way. We want to prioritize. So this is always important because regardless of how well we get along with our providers, we're not the only patient they have. And so there's schedules, there's appointments, there's times, there's people have got to get through. And that's true for in-person appointments, and it's true for on the phone as well. That we're going to be one of who knows how many folks that need to be spoken to that day. So we want to stay on point. Make sure that, when we go into that, whether it's a video appointment or a phone appointment or it's in person, that we go in organized, that we know what our priorities are. So maybe you have a provider that, you can speak kind of freely about multiple things. Maybe you have a provider that sets limits, one issue or two issues per visit, so you might be really well versed in prioritizing and setting kind of limits on yourself. But for those maybe who have providers that you can speak more freely with, that might be harder to do right now. So making sure when we go into those appointments, however they're set up, that maybe you have a priority of, if you could only speak about one or two, maybe three things in this visit, what do you want them to be? And, anything else is a bonus. So that ideally, again, if you get to those bonus things, great. If you don't, but you got maybe the top one or two things addressed, and maybe the rest can wait for another appointment. And along the line, we want to stay to the point. So again, we might have a really great relationship with our provider, and it might be very easy to speak. But again, so just staying organized and making sure that we stay true to, again, I've had the experience, maybe you have too, right? That you go in for one thing, something else is kind of in the back of your mind, but then you get talking about something, and then you leave the office and realize, whoops, I didn't bring that thing up. And there I am back, or there you are back at the front desk booking another appointment. So just trying again to keep ourselves organized, keep ourselves on point, on track. And the next being, giving some feedback. And I think, and this could maybe, especially right now, as like I said, we're all learning this together. So we're still collectively relatively new at this. So video, phone, not necessarily seeing people in person, being a new way of doing things. It's a new way of business. And it may go well. There may be things that don't go so well. So there may be looking for opportunities that if something's not working for you, to have that conversation with your provider of, I really had a hard time with, I wasn't hearing very well maybe, or, whatever it might be, right? That this could be an opportunity that it's not really about the provider necessarily, but it's just about kind of working with what we've got right now, and trying, because hopefully the providers involved in your care are invested and they want to see you getting the best possible care, even within these exceptional circumstances. All right. And so along those lines, we're kind of trying to stay organized, keep ourselves on point, keeping track of things. We might consider a little bit of health journaling. And so health journaling is really just note keeping notes for yourself about your health. It can look and happen lots of different ways. It could be as simple as just like a spiral bound notebook, right? That you just jot things down. It could be a binder if you're kind of tech savvy. It could be a document on your laptop or your tablet. And essentially, it's just a spot to keep organized for you to keep track of things about your health. And so it can be as detailed as you want, or it could be kind of as simple and kind of quick and go. But it's a spot where, you might consider keeping lots of things. So, if this is something that you might want to do in a longer term, you might want more information. But it might be something, again, right now that might have a different layer of importance. Again, as maybe you're not having the same frequency of contact with healthcare providers that you usually do. You're maybe not being seen in person. And so it could be a spot just to notice things, keeping track of your symptoms, keeping track of any exposure to triggers, when you're taking medications, when maybe your last flare-up was, and what you took at the time and how well it worked. That we could keep these things written down, and even too, questions that come up or concerns or things we're not sure about, so that when we do have those appointments, again, however they're being done, we have a spot to refer to that can keep us on track, remind us of what we wanted to talk about, and where we can also write things down, right? Things that are said, maybe a new term, a new diagnosis, a medication we want to learn more about. And again, it can be that spot to keep kind of a running list of questions or things we want to bring up, so that again, when it comes time to make that appointment, have that conversation, we've got kind of a one-stop shop of information that we can refer to, again, to keep us organized. Because, the mind's a busy place. And, there's a lot buzzing around in there, and it's easier than we might think to lose track of important information sometimes when the mind is distracted. All right, and so the last thing I'm going to talk about in this video is advanced care planning. And so this part of the education session is always, it's not meant to be a deep dive into this topic. And so what I always say is, and it's something I'm happy to do now as well virtually, is that if, as I go through a bit of information, if this is something that you want to talk more about, or you want to talk about on a more personal level, I am more than happy to, at this point, have either a phone conversation about it, or if you would prefer to meet in person, that we'll have to wait and see when we're able to do that. But so that's always kind of my disclaimer. I'm happy to do that. This is meant to be sort of a general introduction. And so when we talk about advanced care planning, essentially that is thinking about our future care needs, whatever they may be, right? And so none of us know for certain what our health and care needs will be in the future. We might have certain ideas depending on diagnoses we might have, or things that run in our families, that we may have ideas of how we may age, how our health may change and develop over the years. but none of us know for certain. And I think while it's fair to say that most, if not all of us, hope that we will always be able to make our own decisions related to our healthcare, we know that that's not always the case for everyone. Whether it's we're temporarily unable to make our own decisions, or on a longer term basis are unable to make our own decisions. And so when we think about advanced care planning, it's thinking about what care we may or may not need in the future. What care are we, what extents of care or intervention are we comfortable with or not? What circumstances we may or may not be comfortable with things. And to think about, should we become unable to make our own healthcare decisions, who would we like to make those decisions for us? And then ideally having conversations with that person or persons about our preferences, our wishes, our values, to prepare them for potentially having to make decisions on our behalf. And so in Ontario, when we talk about decision makers, we talk about what's called a substitute decision maker. And that is, again, in the event that we become temporarily or longer term unable to make our own decisions, who is making those decisions on our behalf? And now we have legislation in Ontario that sets out an order or a hierarchy of who would make decisions for us, who our healthcare providers would be looking to for decisions should they be needed. And so that list or order or hierarchy follows different layers of kind of legality versus informality. And so we can do different things. So we might be in a situation where we have a court appointed guardian, but if we don't, the highest ranking person on that list for our healthcare decisions, not our finance or property, would be our power of attorney for personal care. And so this is a document that can be drawn up with a lawyer. There are also kits that can be printed online and completed with witnesses, and there's some rules in the kit about who can or cannot witness depending on who you're appointing. And so that is a written document that we might choose to draft that will clearly state, if I become unable to make my healthcare decisions, here's who I want to make them. And we might name one person, we might name multiple, we may name people that can act independently, or we may want them always to act together, but we can lay that all out in a document. And then that becomes the top ranking person that would be looked to in the need of if a decision was needed. If we do not appoint a power of attorney, again, there is that order that people would go to. And so the way that order would look is, they look for either a spouse or common law partner. They would look for, if still parents or children. They might look to siblings. Then they look to kind of any other relative who's available, appropriate, and willing. And so drawing up a power of attorney for personal care is a personal choice. And it's not something that anybody can make you do. It's personal. And so some people may choose not to for lots of different reasons. And one of those reasons might be when you hear that list of kind of spouse, partner, children, siblings, that might match your wishes. That might be the order you want people to be asked for decisions. And you might choose maybe not to do the power of attorney. Now, we could use a power of attorney document to confirm that order and to confirm, that is the order I would want to happen. And we can just put it in writing and then everybody knows. But that order may not match your wishes. That may be the last order you would want followed. Because in that order, nowhere is listed maybe your very dear friend of 30 years who knows you better than any of those other people in that list. And maybe that's who you want to make decisions, but they wouldn't be looked at based on this list. And situations like that especially might be where you might really want to give some consideration to putting your wishes in writing, especially when you're kind of circumventing or working around that legally prescribed order of people. But again, ultimately, it's a personal choice of whether or not you do it. And that's that. No one can make you, but that could be part of advanced care planning. I think I'm just running up the last page here. And again, and so like I said, that's kind of the summary of that, is that advanced care planning, to whatever extent or degree you decide to take it on, versus whether it's having conversations about your wishes, whether it's as is appointing a power of attorney, whether it's, you know, looking into things like living will documents or different things you might do. It's all personal. And again, it's up to you to decide what, if anything, or how much you do and who you communicate it with. But there are things that are worth considering, right? That again, that none of us know for certain what our needs might be in the future. And so we might think it wise, or might think it a good idea just to give it some thought and some consideration at a time that we're able to do so. All right, and again, but like I said, that's meant to be brief, and I am more than happy if it would be of interest to speak personally about this more in depth. You can just let any member of the team know, and like I said, whether you want to do that over the phone, I'm happy to do that, or we may, I don't know when we could meet in person, but if that would be a preference, we will explore that as well. All right, so that is it for me. So please take good care, and I'll be back with another video.